Hi, Valentino.
Yes.
I'm Lorena, a family nurse practitioner with Grand Canyon University, and I'm going to be doing your physical assessment today. Is that okay?
Yes.
Okay, great. First, I'm going to gather my supplies and wash my hands. I've got my supplies ready to go. Okay. A few questions to start with. What is your date of birth?
3/11/84.
And how old does that make you?
32.
Okay. And what is your ethnicity?
Hispanic.
Hispanic. Do you associate yourself as a male?
Yes.
Okay. And what brings you to the office today?
Stomach pain.
Stomach pain? Where would you say it hurts?
Right about here.
Okay. When would you say that your pain started?
Probably like 3 days ago.
About 3 days ago? Okay. Does anything make it better?
Not really.
Okay. Does anything make it worse?
No.
All right. How would you describe the quality? Is it sharp, dull, aching,
Dull.
dull pain? Okay. And does it radiate anywhere to your back or your chest?
No.
Okay. Do you have any other associated symptoms with it, such as diarrhea, vomiting, nausea?
No.
Okay. How would you rate your pain 1 to 10?
Probably about a 5.
A 5? At its best, the last 3 days, where has your pain been, 1 to 10?
Probably about a 2.
A 2? And at its worst, where would you say your pain has been?
Like a 7.
Okay. What time of day do you have the worst pain? Or is it constant all day?
It just comes and goes.
Comes and goes all day, no specific time of the day?
Not really.
Okay. So we will get back to your chief complaint, but first I have a few questions to ask about your past medical history. And your general health, is it pretty healthy?
Yes.
Okay. When was your last physical exam?
Probably about a year ago.
All right. Was there any abnormal findings at that time?
No.
Good. Do you have any chronic illnesses? And that would be any kind of disease that has persisted for a long period of time?
No.
No chronic illnesses? Okay. And if he did, I would ask when he was diagnosed and how he's being treated and what it is, of course. Do you have any psychiatric history? Any mental illness, hospitalizations, depression, or anxiety?
No.
Okay. And do you have any allergies to medication? Any allergies to food or any environmental allergies?
No.
Okay. Do you take any medications?
No.
Okay. Have you had any surgeries in the past?
No.
No surgeries in the past?
No.
Okay. And have you had any infectious diseases such as HIV or hepatitis C?
No.
Have you had any injuries that have caused hospitalization?
No.
No. And how are your immunizations? Did you receive all your childhood immunizations?
Yes.
And did you get your flu vaccine this year?
Yes.
Good. If this was a female patient, I would ask if she has had a pelvic exam and a pap smear and when that was. Since he is a male, I will just ask, have you been completing your monthly testicular self-exam?
Yes.
Good. And a couple questions get a little personal, but it's important for us to know these. Are you sexually active?
Yes.
Okay. And how many partners would you say you've had in the past?
Probably like 10.
Okay. Have you ever had a sexually transmitted infection?
No.
Okay. And what do you use to protect yourself from transmitted
Condoms.
diseases? Good. Okay. Are you currently are you married?
Yes.
Okay. So right now you're in a monogamous relationship. Do you guys have any plans of pregnancy in the future?
No.
Okay. And you're using condoms to protect from that. Is that correct? All right. Okay. Now we're going to move on to family history. I'm going to be asking about certain family members, and I need to know their age and their health. If they've already passed away, what age they died from and what they died from.
Okay.
Okay, so we'll start with your mom. How is she doing?
Good.
How old is she?
About 55.
And does she have any chronic illnesses?
No.
Okay, and how about her parents? We'll start with her mom. Does she have any chronic illnesses?
No.
No? How old is she?
About 75.
Okay. And how about your grandfather on your mom's side? Does he have any chronic illnesses?
No, and he's about 76.
Okay. And how about your father? How's he doing?
Good.
How old is he?
56.
And does he have any chronic illnesses?
No.
Okay. How about his parents, his mom?
No.
No chronic illnesses. And his dad?
No.
And how old are they?
Also late 70s.
Okay. Do you have any siblings?
Yes, 3.
3 siblings. Are they healthy?
Yes.
All right. And do you have any children?
Yes, 3.
And do they have any chronic illnesses?
No.
Okay. Next, I'm going to be asking about certain disorders, and if anybody in your family has any of these disorders, just let me know. We're going to start with the head, ears, eyes, nose, or throat. Does anybody in your family have any hearing problems or deafness?
No.
How about any blindness or chronic eye problems?
No.
Any nose problems, nose cancer? Okay. Any throat problems, throat cancer?
No.
All right. And is there any neurological problems with your family, such as seizures or Parkinson's disease?
No.
Okay. Is there any cardiac problems in your family, such as hypertension or high cholesterol?
No.
Okay. How about pulmonary problems, COPD or asthma?
No.
Okay. How about any gastrointestinal problems, such as Crohn's disease? Any bladder problems, bladder cancer?
No.
Okay. Any endocrine problems like diabetes?
No.
How about any musculoskeletal problems like arthritis or gout?
No.
Okay. Is there any obesity in your family?
No.
And I mentioned cancer a few times, but is there any cancer at all in your family?
No, everybody's pretty healthy.
That's good. Any bleeding disorders in your family? Any mental health or emotional problems in your family?
No.
Good. Any genetic problems such as Down syndrome? And how about any substance abuse problems?
No.
No. Good. And last, any allergy problems in your family?
Besides regular allergies, no.
Okay, well, great. Sounds like you have a pretty healthy family. Now we're going to move on to social history. These are questions pertaining to your lifestyle. Where is the place of birth that you were?
Phoenix, Arizona.
You were born in Phoenix, okay. And what is your nationality and ethnicity?
Hispanic, American.
Okay. And your marital status, you mentioned that you're married, correct? And what is your occupation?
Own a flooring company.
Okay. Do you have any military experience, or in the past did you travel with military with your family?
No.
Okay. What is your socioeconomic status? Do you have any concerns paying your medical bills?
No.
Good. And what is your living arrangement?
I live in a house with my family.
Okay. What do you do for fun? What are your hobbies?
I like to play basketball and golf.
Okay. And do you partake in any alternative medicine or practices?
No.
Okay. Is there any concerns for safety at your house or violence?
No.
Good. Okay. How do you manage your stress and your emotions? Does golf and basketball help?
Yeah.
Yeah. Okay. And how many hours of sleep do you get a night?
About 6.
About 6. Do you feel rested in the morning?
Yes.
Good. And I'm going to ask about a few habits of yours. How is your diet? Do you eat a healthy, well-rounded diet?
Overall, yeah.
Okay. Do you have any restrictions?
No.
No restrictions with your diet? Okay. And do you drink about 8 glasses of water a day?
Yeah.
Good. Do you ever use any laxatives?
No.
Okay. And do you drink coffee?
Yes.
How many caffeinated drinks a day would you say?
About a cup a day.
Okay, good. And do you exercise regularly?
Yes.
Okay. How often would you say you exercise?
About 3 days a week.
Good. Do you smoke at all?
No.
Do you drink any alcohol?
No.
Do you do any drugs?
No.
Okay, so that completes the social history. Next, we're going to do a review of systems, and this is going to include things that you have felt in the past couple of months. We'll say the past 3 months or so.
Okay.
Your overall constitutional health, has it been okay?
Yes.
Good to hear. Have you noticed any eye problems, any blurry vision, floaters? When was your last eye exam?
No. Probably about a year ago.
Okay, good. Next, we're going to go to the ears. Have you noticed any hearing changes?
No.
Have you had any discharge or pain from your ears?
No.
Okay, and how about your nose? Have you had any nose pain?
No.
Any runny nose or smelling problems? Okay, and how about your mouth and your throat? Have you noticed any changes with swallowing? Have you had a sore throat? Any sores or lesions in your mouth? And when was your last dental exam?
Probably about a year ago as well.
About a year ago. That's good. Okay, and how about any cardiac changes? Have you noticed any chest pain recently, or heart palpitations, skipped beats, any fluttering?
No.
Any shortness of breath with or without exertion?
No.
Okay, and how about your respiratory? Have you noticed that you've been short of breath, or have you had a cough recently?
No.
All right, that's good. And your GI system, have you been having regular bowel movements?
Yes.
Okay, you haven't noticed any diarrhea, constipation?
No, just regular.
Okay, how often do you have a bowel movement?
About twice a day.
Twice a day, and when was your last bowel movement?
This morning.
Okay, and how would you describe your stool? Is it normal, soft, and formed, or something different?
Just normal formed.
Okay. And have you had any problems with your urinating? Any burning or blood in the urine?
No.
No? Okay, you haven't had any abnormal discharge?
No.
Okay. Your musculoskeletal system, have you noticed any painful joints, any sore muscles or cramps recently?
No.
And is your range of motion okay? Haven't had any problems there?
No, not at all.
Great. Your skin, any rashes, any dry spots? Have you noticed any changes at all with your skin? Any new lumps or nodules?
No.
Okay. And neurologically, have you noticed any stress, any depression or anxiety, any changes in your sleep habit recently?
No.
Good. How about your endocrine system? Have you noticed that you've been hot or cold recently? Any hair loss suddenly?
No.
Okay. And any weight change recently in the last 3 months?
No, not really.
Okay, good. Your heme and lymph system, have you noticed that you've been bruising more often, or you've been getting sick more often?
No, just normal.
Normal. And any wounds that are not healing quickly, or is it just normal healing?
Just normal healing.
Great. Have you noticed any allergies recently to something new, maybe a new medication or a new environmental source?
No, not at all.
Okay, now we're going to start the physical part of the assessment, and I have standing before me, or sitting before me, a 32-year-old Hispanic male who is well nourished. He was able to walk in independently. He's alert and oriented, cooperative, and mood and affect are appropriate. He is having no difficulty breathing and no acute distress. He is well groomed and dressed appropriate for the weather. There is no odors, and he is cooperative and attentive. At this point, I would ask the instructor if I have my vital signs for you, height and weight, and Snellen chart results. And if so, then I would mention that the Snellen chart took care of cranial nerve 2, which is optic. So throughout my exam, I'm going to be assessing your hair, skin, and nails for any abnormalities. I'm going to be looking for your color of your skin, temperature, the hydration of your skin through skin turgor. I'm going to be looking for any rashes, moles, or nevi. If I do see any nevi, I will assess them using the ABCDE evaluation tool. And I'll also be looking at your joints throughout the assessment.
Okay.
So first we're going to start with the head. I'm going to put my clipboard down. And with your head, I'm going to inspect that everything is symmetrical. There is no swelling or edema anywhere. The hair is dark and thick. It's evenly distributed. I'm going to go ahead and start palpating your head. And I'm just feeling for any nodules or lesions or abnormalities. His head is of a normal cephalic shape. There are no inhabitants. And there is no alopecia noted. Now I'm going to palpate your frontal and maxillary sinuses. Is there any discomfort?
No.
Okay, I'm going to feel for his temporal arteries. They are present on both sides. Okay, if you'll open and close your mouth for me. Great, and close. No TMJ noted. Can you feel me touching on both sides of your face?
Yes.
Can you feel this up here?
Mm-hmm.
Great, will you smile? Good, and raise your eyebrows. Okay, cranial nerve 5 and 7 are intact. 5 is trigeminal and 7 is facial. Okay, and next I'm going to be looking at your eyes, and the eyelids are not drooping, they're equal. And I'm going to look at your sclera, they're both white. Look up for me. The conjunctiva is pink, it's not red or irritated. I'm going to look at the pupils, the cornea, the lens, and the iris. They're both intact and without any abnormality. So I'm going to grab my instruments here. Next we will be doing the ophthalmoscope exam, and for that exam we would have the lights off. And I'm going to ask you to follow my instrument. We're going to do 6 cardinal gazes, and just your eyes. You can keep your head still, there we go. And down to the middle. This is testing for cranial nerves 3, 4, and 6. 3 is ocular, motor, 4 is trochlear, and 6 is abducens. Next, I'm going to use my light to check for pearla. Just look straight. Okay. And the pupils are equal, round, reactive to light, and accommodation. Next, I'm going to be looking inside the eye and doing my ophthalmoscope exam. I'm going to look for the red reflex first, and then I will focus in to see some more anatomy in the eye. Red reflex is noted. Coming in closer. And I was able to locate the optic disc. The disc to cup ratio is 3:1. The vessels were noted. The macula and fovea were noted. So I just did your eye exam, and I would repeat the same on your left eye. Next, we're going to be doing the ear exam. I'm going to start by inspecting your ears for any redness. I'm going to look for any obstructions in the ear canal. I'm going to palpate for any tenderness. Does that hurt?
No.
And that was the tragus that I touched, and there was no tenderness. And so now we'll do the whisper test. Go ahead and cover your left ear and repeat what you hear. Red.
Red.
11.
11.
Bird.
Bird.
Okay, and that was a pass for the whisper test. Now we will do the Rene test. And what you're going to do is you'll tell me when you stop feeling the vibration, and you'll feel it back here, and then I will switch it over and you'll tell me when you stop hearing the vibration. Okay?
Okay. Okay.
Okay, and that was a 1:2 ratio, which is a pass. We would repeat this test on the other side. Now we're going to do what's called the Weber test, and I want to make sure you can hear the vibrations on both sides of your ear.
Mm-hmm.
Yes, okay, good. Hearing is intact. Now I will grab my otoscope and look inside the ear. Okay. Okay, and what I'm looking for is the gray pearly tympanic membrane. I see the cone of light, no injection, no redness. And I'm looking for the umba and the manubrium. And all of that is noted. I would go ahead and repeat this test on the other side. While I have my light, I'm going to look inside your nose. First, I'm going to inspect visually and see that it is midline and no abnormalities noted. And will you cover one side of your nostril and breathe in? Good, and now the other side. Okay, that tells me it is patent. Look up for me. I'm going to look inside, and I can see that the nasal mucosa and the turbinates are pink and moist with no abnormalities. And if you'll close your eyes for me and tell me what you smell.
Alcohol?
Yes. Cranial nerve 1, olfactory is intact. Now we will move on to the mouth. Okay, if you will say ah and stick your tongue out. Say ah. Good. And I can see that his tonsils are about a 1+ grade. Go ahead and open your mouth. And I'm looking inside, and I see that there are no loose teeth. I don't see any abnormalities inside. The mucosa membrane is pink and moist. The anterior and posterior pillars are noted, as well as the hard and the soft palate. Next, I will have you stick your tongue straight out. Move it side to side. Okay, thank you. We just covered cranial nerve 9, 10, and 12, glossopharyngeal, vagus nerve, and hypoglossal nerve. Next, we're going to move on to the neck. I'm going to just visually inspect the neck for symmetry and no edema. I'm going to feel the trachea and make sure it is not easily displaced. If you will please shrug your shoulders. Good. That takes care of cranial nerve 11, which is spinal accessory. If you'll turn for me a little this way, I'm going to feel for the thyroid. Go ahead and swallow. And I felt the thyroid drop. There's no goiter and no nodules on the thyroid. I'm also going to look for jugular vein distension, and I don't notice any of that. I'm going to feel for some lymph nodes, and I'm going to the preauricular, postauricular, occipital, tonsillar, submandibular, submental. I'm going to go down to the cervical chain, the deep cervical chain, anterior and posterior cervical. None of these lymph nodes are swollen or hard, and was there any tenderness on your part?
No.
Okay. Next, we're going to do an exam of your upper body. If I can have you please take your shirt off. Okay, so first I'm going to inspect the thorax. I'm going to be inspecting for any abnormalities, for any scars or hernias. I'm going to palpate for any tenderness in the sternum, skin turgor, and we've got good hydrated skin. And I'm going to auscultate his breath sounds. If you'll take some deep breaths for me in and out. Good, just like that. Okay, and I hear clear breath sounds throughout. And I also want to observe that the AP diameter is 2 to 1. And if this was a female, we would teach self-breast exam. However, breast cancer is not biased to females, so if you ever notice any nodules or abnormalities with your breast, do bring that up at an appointment.
Okay.
Next, I'm going to go to the back. First, I'm going to inspect the back for any abnormalities, any nodules, any scars. I'm also going to palpate for any tenderness. And do you notice any tenderness with any of this?
No.
All right, I'm going to feel for the skin turgor as well. And it's pretty tight, which is good hydration. Okay, no tenderness noted. And will you repeat after, or will you take a deep breath in and out for me? And go ahead and do it one more time. And that is the thoracic expansion. It's equal. Next, we will assess the tactile firmitis and repeat after me. Say 99.
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99.
And I'm testing the tactile firmitis. I'm going to percuss your lungs. And we should be hearing resonance, which I do. Next, I will be assessing the diaphragmatic excursion. If you'll take a deep breath in, let it out, and hold it when it's out. In, let it out, and hold it. Right around there. Go ahead and take a deep, breathe normally. There you go. Now take a deep breath in and hold it. Hold it. So about there. Got a few centimeters there. We got a normal diaphragmatic expansion there. So now I'm going to listen to your lung sounds in the back. And go ahead and take a few deep breaths for me as I listen to your lung fields. Great, got clear lungs throughout. And that completes the back. Now I'm going to come to the front. Okay, thank you. And again, I'm going to inspect the front for any abnormalities. I'm going to palpate for any tenderness in the sternum, the skin turgor. And if we're gonna do the lung expansion, if you will take a deep breath in and out. And out. Good, it's equal lung expansion. And have you say 99.
99, 99, 99, 99, 99, 99.
Good, okay. Next I'm going to percuss. And that is resonance heard. If you'll lift your arms up. And now on this side. Good. Now I'm going to auscultate your breath sounds. Deep breaths for me, please. Great. Clear lung fields. Now I'm going to move on to the cardiac portion of the exam. When I do my visual inspection, I'm going to be looking for any heaves or lifts, and I'm going to be feeling for any heaves or thrills. And noted. I'm going to palpate for the apical impulse. And that is felt. I'm going to listen to your carotids for any bruits. And I'm going to listen with my bell as well. Okay. Next, I'm going to listen to your heart sound using the ape to man mnemonic. Aorta, pulmonic, Erb's point, tricuspid, and mitral. I want to repeat that with the bell. And I'm listening for any murmurs or abnormal heart sounds. What I'm hearing is S1 and S2. Okay, now if I can have you lay back. And I'm also looking for jugular vein pulsation as he lays back, and I don't see any. Now I'm going to listen to your heart sounds again while you're laying down. Aortic, pulmonic, Erb's point, tricuspid, mitral. And I'm going to listen with the bell. And again, I'm listening for any abnormalities, any murmurs. And what I hear is S1 and S2. Heart sounds. Now I'm going to assess for jugular vein pulsation and have you turn your head to the left a little. There we go. And I'm going to look for the pulsation. I'm going to grab two straight edges here. So I'm looking for jugular vein pulsation, and I'm going to measure the jugular vein pressure. What we would do is get the straight edge here, coming up. He's at a 45-degree angle. This will come straight here. And we want to make sure that the measurement is 3 to 5 centimeters, which it is. Next, I'm going to inspect the abdomen, and I'm just looking at the shape, if there's any distension of the abdomen, and I'm not seeing any abnormalities. No hernias, no scars noted. First, I will listen. I'm going to listen for bowel sounds. I'm going to listen at 2 points in each quadrant. And we have normal active bowel sounds. Next, I'm going to be listening for the arteries, the abdominal aorta. I'm going to be listening for any bruits, the renal arteries, the iliac arteries, and femoral arteries. And I'm going to repeat the test with the bell. And there were no bruits heard. Now I'm going to percuss the abdomen, and I want to percuss 2 areas in each quadrant. And what we hear is tympany. Now I'm going to palpate. Do you notice any tenderness?
No.
Okay. And I'm palpating for any masses or any tenderness. While I'm here, I'm going to test McBurney's. And do you take a deep breath in and let it out? At any point, do you notice any pain?
No.
Okay. And now I'm going to do deeper palpation. Any tenderness?
No.
Okay. And I don't feel any masses or nodules. And we're going to also do the psoas test for your abdomen pain. If you'll keep this leg straight and lift it up with my resistance. Okay, bring it down. Did you feel any tenderness with that?
No.
Okay, so now that we've done that, you can relax. Next, we're going to percuss your liver span. Okay, and the liver span is noted. And I'm going to palpate for your liver. Take a deep breath in and let it out. I did not feel the liver drop, which is a normal finding. We don't have any hepatomegaly. I'm going to come over here and see if I can percuss your spleen. And I'm going to palpate, and I don't feel a spleen. That is a normal finding. Next, I'm going to feel for the aortic, for any aortic masses or pulsations, and there is none noted. Now I'm going to palpate for the kidneys. Take a deep breath in and let it out using the duck-bill method, and they were not felt. I would repeat that test on the other side as well. I'm going to come down here and feel for the femoral lymph nodes and for any inguinal hernias. And there's no tenderness noted. If you'll sit up for me and turn a little to the side. Okay, now we're gonna do the CVA test. Let me know if there's any tenderness. Any tenderness noted?
No.
Okay, so we're gonna start with the spine. I'm going to inspect the spine again and feel for any tenderness. If you'll bend down forward for me, all the way, keep going. And now come up, straight all the way, head up. Okay, good. And I was just looking for any scoliosis or kyphosis. We will repeat that test when you're standing up as well. So now we're gonna do the cervical spine. If you'll turn your head side to side. Good. Up and down. Okay, great. And ear to shoulder. Okay. And as you're doing these, I'm feeling, and I don't feel any crepitus, no tenderness. Did you have any discomfort with those movements?
No.
Okay, now let's move on to the shoulders. I'm gonna feel for the shoulders for any edema, any pain, any crepitus. Go ahead and move your hands forward, or sorry, sideways, there we go, and down. Okay, and now forward, bring them both forward, and down. And if you'll put your hands forward and there you go, great. Down again. And I'm gonna look now at the elbow and inspect that. If you'll just, thank you. No discomfort there?
No.
Turn. Okay. I'm gonna come down to the wrist. And you twist your wrist around, up and down. Okay, now let's just assess some strength. Give me resistance. All right, resistance. Good. Now bend your elbow in resistance. Good. Push out. Good. And now wrist up. Good. Wrist down. All right. Open your hands. Your joints are not swollen or red. And separate your fingers. Good. Now bring them together. You have good strength, good range of motion. I'm going to feel for your arteries. I'm going to get your radial artery. It's present at 2+. Ulnar artery. And that is present. Your brachial artery. Okay. And I'm going to repeat this on the other side as well. Next, I'm going to have you close your eyes. And this is sharp, this is dull. And let me know where you feel sharp or dull. You can close your eyes. Is this sharp or dull?
Sharp.
And which part of your arm?
Lower left.
Good.
One.
And what is this?
Dull.
Good. What side?
Bicep. Right bicep.
Okay. And what is this?
Sharp.
Where is that?
Right forearm.
All right. And what is this?
Sharp.
Which part?
Left bicep.
Great. Next, I will do the deep tendon reflexes. So if you'll relax. So we're going to do the tricep deep tendon reflex. Good, that's intact. Rest your arm here. We're going to do the bicep deep tendon reflex. And then we're going to come down and do the brachioradialis deep tendon reflex. And that's intact. Good. While I'm here, I'm going to look at your fingers and assess the cap refill. They are less than 3 seconds, which is good. Okay, I've got a couple more lymph nodes that I want to assess. I'm going to come in here to the epitrochlear lymph node, and that's not swollen. I'm going to come in here and get the axillary lymph node. Okay, and I'm also going to get the lateral, the pectoral, and the subspacular lymph nodes, and none of those are swollen, hard, inflamed, or tender. I'm going to get the intraclavicular and infraclavicular lymph nodes, and those are not swollen or tender. Next, we're going to look at your lower body for range of motion and strength. If you'll uncross your legs, go ahead and raise this leg. Good. And raise this one. Good. Now bring it down. Good. And down here. Okay, bring this leg out. Good. And bring this leg out. Good. I'm going to do the sensory test again. If you'll close your eyes, same thing, sharp or dull, which side of leg you feel.
Sharp.
Which
Right leg.
Good.
Dull left leg.
Okay.
Sharp left leg.
Was that upper or lower leg?
Calf.
Okay. And
Dull right calf.
okay. Now I'm going to do the deep tendon reflex. I'm going to get your patellar deep tendon reflex. Good. Good. Now if you'll flex your foot for me, I'm going to keep it flexed, thank you. I'm going to feel the Achilles. Okay, and let's get this one. Okay. Next, I'm going to feel your pulses. The popliteal pulses are present. If you'll take your shoes off, please. Thank you. Move those aside. Now I will feel for your dorsalis pedis pulses. And present. The posterior tibial pulses. And those are present. Okay, if I could have you stand up, you can get your shoes back on if you'd like. Okay, so if I can have you go side to side, we're gonna do a few more spine range of motion tests. Lean forward and back a little if you can. There you go. And raise your knees up. Raise this knee up. Are you able to turn your ankles? Good. And this ankle. Okay, good. Feet together. And arms out. And now close your eyes. Okay, you can bring them down. All right. And I'm gonna have you turn around for me. All the way. If you'll touch your toes, I'm gonna assess once more for your scoliosis and kyphosis. Go ahead and touch your toes. Okay, and come on back up. There's no curvature, no signs of scoliosis or kyphosis. Okay, if you'll walk to the wall and back for me, and I'm looking at his gait, it's steady, his coordination and balance. And thank you, Valentino. This completes our exam.